theories of use, constitutional or the classical. That's what Dr. Hahnemann is. He was a constitutional or classical. Constitutional means your genetic makeup, your dosha type. Classical. And the classical homeopath would use this 2 or 3 hour interview, and he would use one remedy based not so much on the symptoms of your disease, but on your genetic makeup, your appearance, your thoughts. Like the dosha, we had a dosha type you could predict somewhat. That's what constitutional prescribing is. It takes a lot of time. Clinical is more based on the symptoms that are more specific to the disease, and you might use several remedies. Complex is more like homotoxicology, which is combining several remedies in one dose, or in one dose to achieve the effect. What makes that easier? With classical, you get very specific. You've got to get right on to get the match perfect. With complex, you can just get close. And by combining several remedies that have similar effects, it's like a combination effect. You don't need to be that accurate. You can just be close to it and get the same response. So for people that are not as skilled as the classical homeopath, it's a lot easier to use. And that's what most of us who say we're homeopaths, we're not classical. Only a handful of people are really qualified and skilled to do that. Most of us use complex homeopathy. The dosage is I'm not going to do that. Okay, now, there are 2 major books that are used in homeopathy. In traditional medicine, we have 2 books one's called the National Formulary and one's called the United States Pharmacopoeia. These are the books that define and explain what drugs are, and they have to meet certain criteria to be included. In homeopathy, we have a repertory and a materia medica. These are all computerized now. But the repertory is a listing of all the symptoms that people experienced or described or felt when they were doing their proving. So you have a normal healthy person, and these things are going on right now throughout the world. So you have a normal healthy person or persons, and you give them a remedy full strength, and then you record everything that person experiences, what their thoughts are, what their feelings are, if they get a rash, if they get diarrhea, if they vomit, if they get blurred vision, if they have negative thoughts. You write all those things down. And that's the remedy picture. I'm sorry, the symptom picture of the person based on their response to that remedy. So it's an index of the symptoms that people experience when they took the homeopathic remedy, actually when they took the substance full strength. Materia medica is the reverse of that. That's the symptoms that are caused by those medicines and everything that a patient experienced. So you try to match the symptom picture to the drug picture, and the closer your match, the more likely you're going to get a desirable effect. You match the symptom picture to the drug picture, and the more closely the match, the more likely you're going to get a positive response. So homeopathy peaked in the early 1900s. What was happening in this country right about that time, homeopathy, I think we'll go to the next. There were several things that happened that caused it to begin to decline, but that was the pinnacle. And what happened? We had in this country. I talked about how barbaric our system of medicine was when General Washington died. or President Washington died. But we eventually had four competing interests in this country, medical interests. We had people that were doing homeopathy. We had people that were doing herbal. We had people who were, at that time, you could become a doctor by saying, I'm a doctor. But in the early 1900s, some of the more educated doctors who were better trained began to object to all these other people practicing medicine. And they were more effective in their efforts. So in 1912, the Flexner Report came out. That was a report commissioned by Congress to try. Remember I talked in traditional Chinese medicine when the Chinese communists took over, and they had many different systems of Chinese medicine being practiced, and then they consolidated that into one called traditional Chinese medicine. That's what the Flexner Report did. It took all these different systems of medicine that were being practiced in this country and said, we're going to put requirements for what you can do in order to practice medicine. And the way they accomplished that is they removed funding for everything but the medical education. So if you're an herbalist or you're a homeopath, at that time there were many schools of homeopathy. There were over 100 hospitals in this country that were exclusively homeopathic hospitals. I think there were 22 medical schools that were exclusively homeopathic medical schools. But with the Flexner Report, that ended that. There was no more funding. So it disappeared, as did most of the others. And the other thing that contributed to it, the medical doctors were pretty uniform. But the other systems of medicine were fighting among themselves. So they couldn't put up a good argument. The homeopaths were arguing, there was an argument between the classical homeopath and the clinical homeopath. So each said the other was wrong. So they didn't have a uniform response to the medical education. So that was the other reason why it fell out of favor. But it never, ever really went away. It seems to have, I had never even heard of homeopathy until in the 1980s, I guess, when I first became aware of it. But it began a resurgence in this country in the 60s. And a lot of that had to do with people's concern about already we were experiencing adverse effects from drugs. You know, in late 1950s, probably 58, early 1960s, was probably when prescription drugs first really became significant. And one of the first ones was the birth control pill in the early 60s. But we already knew then, that it didn't become an issue until the 80s, early 90s, that form of medication contributed to cancer. Had a lot of adverse effects. The public was aware of that, and they were looking for something other than, even then, looking for something other than prescription drugs. So many of the problems with prescription drugs don't occur in the studies. The studies may only last 6 months or a year. It's not until the drugs get out on the open market where you have a lot of different, and they're usually done with fairly normal people. So the problems don't really develop until they've been on the market for years. And then reports start coming in of all the side effects. So that's what contributed to people looking for another way. They wanted a different way to treat themselves. There's also, when there was a change in medical education in this country. Up until then, the physician took more time with the patient and understood the family, understood the patient. There was more conversation. But the medical education began to change because we had prescription drugs now. So the emphasis was on a prescription that would cure the symptom, not trying to treat the whole person, but you're just getting rid of the symptom. That was, and the medical education reflected that, as did the education for most of the other healthcare professionals. So in the 60s and 70s, we saw a great deal of change in education. Interesting, when I started studying homeopathy in the 1990s, almost all of the instructors that I studied under were medical doctors or naturopathic medical doctors who had begun 20 years ago changing their practice to incorporate homeopathic medicine. So these were very, very brave pioneers.